As a nation, we're ageing and suffering increasingly from non-communicable diseases such as diabetes. While national healthcare budgets are static or shrinking, the pharmaceutical industry has spent billions developing new medicines to treat or control these diseases. The trouble is, a lot of the time we don't take them.
The problem is absolutely huge. The prescription of a medicine remains the most common medical intervention in developed health economies like ours. But WHO and other sort of reviewers estimate that about half of prescribed medicines for long-term conditions are not taken as recommended.
And we know the cost of non-adherence is substantial, billions and billions of dollars. So if we could only engage with these patients, help them understand the benefits of taking the treatment, we can optimise health outcomes and keep patients out of the clinic.
For the last 15 years, Andrew Martello had been working in the pharmaceutical industry, marketing innovative and effective new medicines, while Professor Rob Horne had been conducting in-depth academic research into how people perceive those medicines and the barriers that prevent them from taking them as prescribed. Rob had come to realise that the best way to put his knowledge to practical use in the real world was to start a new company dedicated to improving adherence, and he identified Andrew as the man to lead it.
Fundamentally, Spoonful of Sugar exists to make the most of medicines. We understand that the rate-limiting step between effective treatments and optimal health outcomes is behaviour.
Spoonful of Sugar is based on the blending of world-renowned academic research with commercial expertise and cutting-edge technology. But it took a third element to help the company through its formative years. UCL Business, the university's commercialisation arm. Executive Director Anne Lane has a great deal of experience in promoting spin-outs from university research programmes. How did she view Spoonful of Sugar?
It was based on very sound evidence. There was an unmet medical need and then there was an unmet business need. It made perfect sense because it was very complementary to what we were already doing in terms of the pharmaceutical technologies that we develop, because it's based on patient compliance and making the most of medicines. It fitted in very well with what our aims were, so we're very happy to help and support it.
The company's grown rapidly. Within a few weeks of its foundation, it had already won business with Pfizer, and it now numbers many of the world's leading pharmaceutical companies among its customers. An essential element of its philosophy has been putting patients centre stage and treating each one as an individual.
All kinds of people have these long-term health conditions, and so it's really about creating content that works for each of those audiences. It's very much about them not feeling spoken down to, them feeling empowered and really able to take control of their own health.
The trick is to assess for each patient or for groups of patients what their key needs are and to tailor the sort of support to meet those needs. And that's very much at the core of the SOS offering.
We know that there are millions of people living with these long-term non-communicable diseases across Europe, and to reach them we're going to have to embrace the role of technology. So our team here are very much engaged in innovating solutions to provide tailored, personalised content.
At Spoonful of Sugar, we really do believe in creative ways of delivering this content, and creativity is essential in capturing people's interest, and also that they just take something away from it where they feel a bit more empowered, confident in themselves.
So Spoonful of Sugar has seen exponential growth since our formation in 2011. We have a great team of individuals who are passionate about the patient's perspective. Obvious challenges in terms of two very different sectors, the commercial world and the academic world. Everything we do is created collaboratively and with a wide range of experts. And to do that, you have to really understand the individual needs of each of those stakeholders before you embark on that programme.
It's a bit of give and take. It needs a huge amount of commitment. But on the positive side, I think it's hugely rewarding.